Thank you, everybody, for joining. It's great to see you all, even if it's virtually. But we've been doing these all over my congressional district, and it's about as close as we can come to a regular town hall meeting. Plus, I get to see your kitchens and living rooms, and you get to see mine. So there's the added fun of that. First of all, I hope that everybody is healthy and safe. I know at this point in the crisis, none of us has been untouched. All of us know somebody who has been affected, and in some cases, tragically. And we are at a particularly difficult moment in New Jersey because I think we're right about at the peak of the impact of this epidemic. We've had over 68,000 cases so far. More than 2,800 New Jerseyans have died. In Morris County, almost 200 of our fellow New Jerseyans have passed away because of coronavirus, and those are just the official statistics. We know that the true numbers are higher because of the shortage in testing that we are working hard to overcome, but is still a very, very real problem for all of us. And as for the rest of us, we're staying at home, and I know that can be frustrating. I know that can be isolating, but I want everybody to understand that what you are doing simply by staying at home, simply by respecting the public health advice that we are getting, is saving lives. It is enabling our brave nurses and doctors, our frontline healthcare providers, to be able to do their jobs without being completely overwhelmed. And though it may feel like we're alone because we're sitting alone or with just a couple of people in our homes, we are really part of an amazing collective effort. One of the most extraordinary collective efforts that the American people have ever undertaken to defeat a common enemy. And as difficult as some of the news has been recently, I think there is evidence that it is working. If you look at the statistics for New Jersey, looking, for example, at the number of people who are on ventilators in our state, that has not increased in the last few days. In fact, it's even gone down just a little bit. We've had small increases in the number of people in critical care and in intensive care. But overall, the last week or so, those numbers have held relatively steady, which suggests that we are beginning to bend the curve. We are at least succeeding in making it possible for our hospitals to deal with this thing without breaking. And that's the product of what we are doing right now. So I want to thank everybody who is part of this common effort, number one. Number two, I want to let you know what I've been doing. My focus has been on several key parts of the response. Number one, I already mentioned the importance of testing for a coronavirus. We are not going to be able to resume normal life in America until we have widespread testing for this disease. This is where a lot of countries got a head start and where we were slow. And right now, we're still not where we need to be. Morris County has a drive-through facility. We're now at a point where every county in my congressional district has a place where people can go in their car and get tested, but you still have to be symptomatic. You still need a doctor's recommendation. I've worked really hard to try to get us just to this point, and a lot of that is just a struggle to get the personal protective equipment that our healthcare workers at these sites need. It's gotten so bad that, elected officials, members of Congress, have to be working the phones every single day just to find masks and gloves and basic things that you would think our healthcare system would have insufficient supply to meet a crisis. So you know, I've been doing that work and I'm proud to have had some successes, but I'm not happy that we have to do it, that our system wasn't built to meet this kind of crisis. So I am, in addition to just trying to fight to get the testing for my constituents, also trying to fix this bigger shortage of personal protective equipment for the country as a whole, not just for this crisis, but for future crises. And I'm introducing legislation this week to do that. We can talk about that if you like. Number two, we've got to help people survive this economically. We want to make it economically possible for everybody to follow the advice that we're getting from our medical professionals. So if your business is shut, if you've lost a job, if your income is drying up, we got to help you. The government is telling you to do these things, and we have an obligation to help. So, as you know, we passed several pieces of legislation, most recently the CARES Act, which aim to help. We've got checks going out by electronic, by direct deposit this week from IRS to individuals and families. $1,200 per individual if you made less than $75,000 last year. We've got extended and enhanced unemployment insurance for people who have lost their jobs. And we've got a program called the Paycheck Protection Program, which to me is the most important part of this, even though it's been very difficult to get it right. And that's a program that allows our small businesses to get loans through their bank, but really from the federal government, that are 100% refundable. It's free money, so long as those small businesses retain their employees on payroll through the end of this crisis. That rolled out last Friday, so it's been out for maybe 6 or 7 working days. It's been chaotic. I know some business owners who've gotten good help. I've known others who are intensely frustrated right now because their banks are not providing them what Congress promised. So we're working hard to fix that now, and probably going to pass another bill, I hope this week. We're negotiating with the Senate right now to try to get something good that both replenishes the small business program. We think we also need to provide more aid for our hospitals and for our local county and state governments, because we don't want Morris County to go broke. We don't want Dover or Mount Olive to go broke because tax revenues are drying up. So we're trying to solve all those problems at the same time in real time. There's a lot more that needs to be done, and I assume you guys will have a lot of questions on what I said and things that I left out as well. So I want to turn to that now and hear your thoughts and suggestions and concerns, try to answer your questions. And it can be on the coronavirus, it can be on any other issue, because this is just like any town hall that I used to do in person. I'm open to taking any question on anything at all. And if we'll try to get to everybody live over the next 45 minutes or so, but if we don't, then we'll try to get back to you after this session if you're willing to leave us some contact info in the chat. So with that, turn it back to DeAndre to open us up to Q&A. Thank you very much.
Thank you, Tom. And just a reminder for everyone that's on the call, if you would like to ask a question, please use the chat feature at the bottom of your screen. You may also use the raise your hand feature, or if you are live on the camera, if you just wave, I'll be able to see you and we can get your question hopefully in the chat, and we can definitely get the congressman to answer it. Tom, your first question. What policy/timeline will be put in place to open up enrollment in ACA for those who are uninsured?
So if you lost your job because of the coronavirus crisis, or for any reason, if you lost your job, then you can enroll for the Affordable Care Act for health insurance coverage under the ACA. Get the subsidy if you qualify for it. So that's the good news. The bad news is that we have also tried to persuade the Trump administration to open up enrollment to everybody in New Jersey. And so far, they're saying no. So we're going to continue to push for that. I think it's the least that we can do to make sure that nobody falls between the cracks at a moment when so many of us are vulnerable. But, you know, as you guys know, the Trump administration is not a great fan of the Affordable Care Act or universal access to health care, and they're not making it easy for us there right now. But again, if you just lost your job as a result of this, then you can enroll. That rule still exists.
Thank you, Tom. Our next question comes from Nicole from Flanders. Nicole, can you hear us?
Yes, I can. Hi there. How are you?
Hi, Nicole.
Hi, I'm an occupational therapist and I'm working home care for a very large health organization in northern New Jersey, obviously.
Mhm.
And, you know, recently in the state of Washington, the governor passed a law that if you work in one building, you can't go from building to building because it was aiding in the spread of the virus. Now, what's happening because our census has decreased recently is that our organization is asking us to do things like go into the hospital to disinfect elevators, to sit with patients who are possibly COVID positive. And then on our days that still have a full caseload of home care patients, go back into these clean homes. I've been concerned about my risk to patients' health since the beginning of this travesty started to begin with, in that what risk do I pose to my patients going into their homes? So I've been wearing a mask long before they told me that I should be,
Mhm.
and trying to limit whatever exposure I might be providing to them. But our goal is to keep them out of the hospital. And now we, as you know, therapists and staff, are being asked to make the ethical decision of you either go and you do these jobs in the hospital and potentially become a carrier, or you have to use your own sick time and PTO to compensate for the low census. I was under the impression that huge healthcare organizations just got a large sum of money on Friday deposited to them from the CARES Act, and that would help to compensate for lost revenue. So I'm just wondering, what protections do we have as healthcare employees at this time? You know, if I use all of my sick time to compensate for low census, then what happens when I eventually get sick? Because I will, because I'm going into patients' homes every day in the community. And there really doesn't seem to be a good answer to that right now.
Thank you. That's a really good and legitimate question, and I'm glad you raised it. First of all, and I know this isn't the main part of your question, but if you do need to take sick leave because you're sick, by law, by both New Jersey law and now federal law, your employer is mandated to give you that 3 weeks, 2 weeks sick leave under the federal law and a week under New Jersey. So that's 3 weeks right there. They are supposed to give you paid sick leave. And on the federal side, the federal government will reimburse your employer for that. So, you know, hopefully you don't ever need to do that.
Right.
But, you know, you have that cushion, you have that assurance that if you have to, then it's there, whether you've used up your sick leave or not. That's number one. Number two, you know, I try not to opine on things that I'm not an expert on. I'm not a doctor. I'm not a public health expert. But what you just described does strike me as not advisable. When you have people working in a hospital and then going into a home care setting, that doesn't sound right. And I think what I'd like to do, if it's okay, is have a staff member talk to you about this afterwards so that we can get more detail and maybe connect you to New Jersey Department of Public Health to see if they have any policies that already apply to this, that your employer should be respecting, and if not, whether they need to establish that kind of policy. At the very least, I think they need to know that this is going on.
Thank you.
Alrighty. So if you're willing to just maybe in the chat, just write your email or phone number, however you'd like us to get in touch with you,
Sure.
and a brief note just summing up our
Yes,
exchange.
and I've been in touch with Rebecca over the last few weeks. She's been helping me with a couple things, so I appreciate her help from your office as well.
Fantastic. Good. Well, we're happy to try to help with this.
Thank you.
Okay, and thank you so much for your service at this difficult moment. You're a lifesaver.
Well, thank you.
Thank you both. Our next question comes from Corinne. Corinne, can you hear us?
Yeah, yes, I can.
Go ahead.
So my daughter is a nurse in a hospital setting right now with low access to PPE, but my sister is a nurse in a nursing home. She works for one of the largest nursing home companies, if not the largest nursing home company in the United States. And their company just had the incoming shipment of PPE seized by the federal government. And so now they are back to homemade masks and reusing masks, N95 masks, reusing them from non-COVID to COVID rooms, which I'm sure we can all understand now is a huge risk. She doesn't understand why this happened. They hadn't asked for anything from the federal government. So to have what was coming in for that company seized by the federal government was almost unconscionable. And the feeling among the staff there and among some of the clients is that their lives are expendable. The lives of the clients in nursing homes and rehab facilities and those who that care for them don't count for much, unfortunately. And I'm at a struggle to explain this or even to respond to it.
Sure.
Yeah.
Well, I can try to explain what's going on. I'm not going to justify it. And first of all, I would like to get more detail about what happened, when it happened, where it happened. So if I could make the same request of you,
Sure.
talk to our team afterwards, because we've got to run these things down. But here's what's happening in general. There's a national PPE shortage. As you know, it's shameful. That's, we have all the money in the world, but we don't have the stuff
Right.
to buy. And so therefore, decisions have to be made about who gets it as a priority matter. Obviously, hospitals are at the top of that list. Nursing homes, for the state of New Jersey, are supposed to be next, but they're not first. And so it's definitely a missing piece in the puzzle right now. The seizure is another matter, but the fact that we have nursing homes that don't have enough, that's unfortunately very, very commonplace. Now, on the national level, we have been advocating basically to the president, to the federal government, you're either in or you're out. If you're in, which is preferable, then I don't care. They should seize all of it, right? Let's have the president use his powers under a law called the Defense Production Act, which allows him to tell companies that, you know what, you may have been making cars last week, but you're making tanks today because we're at war. Except in this war, it's not tanks. We need masks, we need gloves, we need ventilators. So he's got the power to do that. And should have been doing it starting in February. As it is, the first bulk order that the federal government placed for masks from 3M, the biggest company that makes this stuff, didn't come until late March. And we're not getting them till late April. So ideally, we would have had the federal government say, we're going to take this over. We're going to have a national strategy for making companies produce the stuff. The federal government will take it and then distribute it to states based on need, not based on who's being nice to the president, but based on need. And so, if they were willing to do that all in, then I wouldn't be so upset when I hear that they redirected a shipment because somebody else needed it more. But instead, they're kind of half in, half out. They're not going all in with a national supply chain, but in individual cases, they seem to be taking and redirecting. in ways that are not transparent, very hard for people to understand. And so what we've told them again is all in or out. If you want us, if you think it's a state responsibility, we're on our own, then let us do it, damn it. Don't take what we are ordering. And if you think that you know better and that you can direct it to where it needs to go, then take responsibility for the whole thing. So that's the debate that we've been having. But again, let me ask you if you're willing to give us some more details, and we can try to see what may have happened in that specific instance. Thank you.
Thank you both. Our next question comes from Jennifer. Jennifer, can you hear us?
Yes, I can. Can you hear me?
Yes.
Good.
Yes.
Thank you so much first for doing this. Really appreciate it. I want to know what's being done to ensure the safety and fairness of our election in November. Mm-hmm. We desperately need a change of administration. And we must, in my opinion, move to total vote by mail in November in order to make sure that everyone is enfranchised, everyone who is still sheltering in place, which is certainly a possibility, has the option and the ability to cast their vote. And I wanted to know what Congress was doing to ensure that this happens.
Thank you. So it doesn't matter whether you want a different administration or not. It doesn't matter if you're Republican or Democrat, if you like Trump, if you don't like Trump. All of us have a stake in a credible election in which everybody who wants to vote can vote. That's basic. Everybody should agree on that. We just saw what happened in Wisconsin. People were forced to choose between exercising their constitutional right to vote and protecting their life. Absolutely crazy that anybody in America should be forced to make that choice. I've seen it in other countries like Afghanistan or Iraq, you know, where people line up and they risk their lives to vote, and it's really inspiring that they're so courageous. We should not have that in America, right? And we've had national elections every year, right? Every 4 years for president since the founding of our country. We had them in the Civil War. We had them in World War II. We do not postpone the national election. We can postpone a primary. We are doing that in New Jersey. It's okay. We can't postpone the national election in November. So we have to make it work for people. And as you say, the only safe and secure way to do that, if this epidemic is spiking again, which it might in the fall, is to give people the option to vote by mail. We have it in New Jersey. Every state should have it. I led an effort to try to get that into the CARES Act, into the bill that we passed a little while back. I got about 60 members of the House to sign a letter with me demanding that we require all states to allow vote by mail and give them some money to help them make the transition. We put that in the House bill, and it went over to the Senate, and Senator McConnell was having none of it. And so we ended up with some of the money, but not the mandate. And then Wisconsin happened. And I think that just adds to the strength of our argument. So we are going to try again and again and again. There's also pressure on states, on governors that haven't done it to do it. New Hampshire just made the switch. There's a Republican governor in New Hampshire. He made absolutely the right decision. So on a state-by-state basis, we're also, I think, going to put a lot of pressure on states to do the right thing. And that's all I can tell you. I will fight this until I've got no fight left in me. And I can't imagine that happening.
Thank you.
Thank you.
Thank you both. Our next question comes from a question that was submitted beforehand that they wanted us to read, Tom. Since President Trump has stated he will not comply with congressional oversight and administration's corporate bailout plan, how will Congress enforce oversight, especially since the Supreme Court doesn't want to expedite any rulings?
So look, there's going to be oversight. And we put several layers of oversight into the CARES Act, particularly as it relates to the part of the CARES Act that allows large companies to get help from the federal government. There's $500 billion in there, and those are loans I want to stress that. We're not handing out money to big corporations. These are loans. But we still want it to be on the level, not corrupt. We don't want any money going. We put in a provision that says no money can go to companies owned by the president, his family, the vice president, members of Congress. And we want to make sure that every penny is accounted for. So one thing we did was that we said there should be an inspector general overseeing this. That's what the president is trying to undermine. He just fired the guy, the inspector general of the Defense Department, who had been slated to play that role. This is a guy, his name is Glenn Fine. He was an inspector general when I was in the Obama administration, and I can tell you he was a pain in the ass, which is exactly what you want from an inspector general. So that's what the president is fighting. But there's a second layer of oversight and a third. The second is we established a congressionally appointed oversight body, which the leadership, Republican, Democrat in the House and Senate, is appointing. The president can't prevent that from happening. And then in the House, we established a select oversight committee to look at how the money is being spent. So there's going to be a lot of sunlight. You know, they say sunlight is the best disinfectant. And that's true even in a pandemic.
Thank you, Tom. Our next question comes from Alan. Alan, can you hear us?
Yeah, I got you.
Go ahead with your question, Alan. Thank you.
Okay, yeah, I tried to get in on the call yesterday. I obviously hit the wrong button because I had.
Here you are. So
I had a question for the commissioner.
Okay.
The labor. Now, I've kind of hustled for the past year. First half of last year, I was out with shoulder replacement.
Yeah.
So I didn't work at all. I'm in real estate, so I'm self-employed. I did Uber, I did DoorDash, and in December I started driving a school bus part-time.
Mm-hmm.
It still paid me about $550 a week driving the school bus, but basically I put in my application for unemployment, and it says I'm entitled to zero. Also on that note, you mentioned the sick leave. I put in for sick pay and I got 10 hours. So it's not exactly a week. It's not exactly 3 weeks.
Right.
So they were supposed to call me, the Department of Labor was supposed to call me yesterday. So I sat around and waited for hours. They were supposed to call me at 10. Nobody ever called me. I don't know whether it was the transition they're making to the new website to include everybody, but I never heard from anybody. And money's getting a little tight over here.
Yep. So a couple things. First of all, it sounds from what you told me that you've been kind of a gig worker, independent contractor in a variety of ways. So traditionally, you wouldn't have qualified necessarily for unemployment, but you do now under the CARES Act, under the bills that we've passed. But here's a kind of a weird thing that because they had to set this up so quickly for so many people, they didn't immediately set up the part of the system that's supposed to help people in your situation. And so what the commissioner last night, I think, would have told you is that what they wanted people to do was to apply and be denied. But that doesn't mean you're denied. It means you're in their system. And as soon as they're ready to handle the gig workers, the Uber drivers, the bus drivers, part-time bus drivers, et cetera, they will let you know and give you your check. Again, if, like I said to some other folks, if you're willing to share your contact info with us, we can try to look in to this for you and see if there's anything about your situation that might create some additional difficulties, and maybe we can help with that. This is a lot of what I'm doing right now. I'm trying to fix the policy for everybody, but then we're going person by person and trying to make sure that they get the help that Congress intended for them to get. But from what you've told me, you do qualify, and you should be able to get something. On top of that, you should get a $1,200 check. Or
Right. Now, what about the $600 additional unemployment, even though it says that I have 0 benefits left?
600 is for everybody. So
It
that
is.
additional is for everybody. Yep. That's the federal bonus on top of what you would normally qualify for. And then the $1,200 check, that's on top of that. And so far it's one time, but we may do it again. And if you've given the IRS your direct deposit information in a past tax return, then they should be just electronically transferring that to you hopefully this week. That's what they say. If you haven't given them that, they are putting up a website. I think it's up already, but we can check on that. That will allow people to give them their direct deposit information now, so that they can get their money early.
Okay, thanks.
Okay, thank you.
Thank you both. Just a reminder for everyone on the call, if you'd like to ask a question, please just use the chat feature at the bottom of your screen. Also, the Congressman has been doing multiple of these calls and had a few special guests, such as the commissioner last night. If you have any questions that pertain to those calls, please feel free to use the chat feature again. The Congressman has become kind of an expert in these areas, doing so many of these calls, so he will definitely be able to give an amount of guidance on these, so we can definitely follow up with those teams to make sure that you get an answer to those questions.
I'll do my best.
I do. Thank you. Our next question is from Annie. I want to make sure I'm saying your name right. Annie, can you hear us?
Yes, that's Annie.
Yep, we can hear you, Annie. Go ahead with your question.
Okay, I saw a report today on put together by prospect.org. I'm not really all that familiar with them, but it seemed pretty legitimate. It said that bank regulators have been giving the banks, or regulators for the CARES payments have been giving banks leeway to use any payments from the CARES Act to an account holder to pay any existing debt that they may have. I didn't know how accurate it was. I did some research and it does seem to be the case. And if it is happening, is there anything that can be done to stop that? Because it seems to be contrary to the intent of the bill.
Correct. So number one, I saw that report. Number two, I'm not 100% sure that it's accurate yet, but let's assume it is. I've been talking to the banks, spoke to Bank of America this morning before I saw that report, actually, mostly to push them to do better and faster on the small business loans. And as I continue to talk to banks, I will raise this with them. If it's true, there are two solutions. Number one, they should just not do it, even if regulators tell them that it's technically allowed. And we can put a lot of moral pressure on the banks not to do this. It would be stupid. It would be totally contrary to the intent of the legislation, which is to get cash to people now. And number two, if that doesn't work, then we're just going to have to clarify in the next bill that they're not supposed to do that.
Thank you.
But if that happens to anybody, please let us know.
Thank you. Our next question comes from Shelley. Shelley, can you hear us? We can't hear you. Star 9, Shelley. Did it work? I mean, star 6. I apologize. Star 6.
Hi, everyone. Thank you for waiting. Congressman, thank you so much. Looking over Mooney Mountain here in Flanders to show you all what a beautiful day is. It's nice to see the faces of my neighbors here in Morris County, and I hope you're all doing well. Congressman, first of all, thank you so much for the constant communication and updates. I listened in yesterday with the New Jersey Department of Labor Commissioner. That was extremely helpful. and also to your previous teletown hall. I have a couple of questions. The first one actually has to do with following up on the question for the ACA. I know that New Jersey is one of the states that is in the current process of transitioning its healthcare exchange from the federal level to the state level. However, New Jersey has the ability to provide access to open enrollment for those who have a life cycle change, as you indicated earlier, that anyone who loses their job, gets married, a divorce, et cetera, that qualifies for immediate opportunity to purchase off the exchange. And we know who the insurers are. The payment online process is all there. I am one of those people in the district and in the state who does not have health care insurance. I do pay for the ACA for my daughter. I do not qualify for Medicaid. And I'm very concerned about the fact that I represent, one of thousands in this state who have the ability to be able to go on to purchase a basic plan, not just to cover in the event that we get sick, but certainly that's my top priority. But also it's a product that I'm purchasing. And I'd like to know if there is any effort and advocacy on your behalf to the state. I know you're a federal House of Representatives for our district, but anything you could do to help move that forward, I think is critically important. I know that there are a lot of people who are unemployed that will be able to do that right away. But for those of us who don't fall into that category, we are definitely at risk.
Yeah. You mean to open up the exchange?
Yes.
So New York did it because they've taken over their exchange. Like New Jersey is in the process of doing, as you said, but we can't do it on our own yet. We have asked as I mentioned before, we've asked the Trump administration to allow an open enrollment period for New Jersey.
Mm-hmm.
They're not agreeing at this point. We're going to keep on pushing for it. I think all of this just reminds us about the holes in our healthcare system. And that's, I think, the advocacy that really needs to happen. We've got pretty much consensus in America right now that everybody should be able to get anything related to coronavirus treatment, vaccine, testing for free. And we've passed some of that in the Congress. Insurance companies have taken it upon themselves to waive co-pays for coronavirus-related treatment. Like everybody gets that, partly because we care about people, and partly because we don't want to get it ourselves. And we know that if there's anybody who falls through the cracks and remains infected, they're going to be spreading it to the community. And so we understand that everybody has an interest in everybody being healthy. But when it comes to cancer or heart disease or diabetes or anything else, we're not there. And so what we really need is a system, I believe, that allows everybody in your position, for example, and all of us, if they want to buy into Medicare at any point, or
a public option would be great.
Public system like Medicare, and that would one, create a competitive option on the marketplace that would drive down rates for everybody, give us all more choices, and you wouldn't have to worry about like an enrollment period. What makes no sense if you step back and think about it. Why should there be a special time in the year when you can enroll for something like this, but other times you can't? Makes no sense.
I appreciate that. Thank you very much. I am going to still advocate here with Governor Murphy, because I believe if we are, if we have people in my position or those that have lost their jobs who can go onto the same website and enroll now, it just doesn't make any sense to me why somebody who wants the ability to purchase a plan, buy a product, can't fit into that. So I appreciate everything you're doing on the federal level to move forward towards a public option. That's critically important. The other question I had for you has to do really with any update on We know that yesterday, I think you said that the Atlantic Health System right now, Governor Murphy has indicated that most of the current hospitals are managing the best that they absolutely can. They're heroic. And that we're not at max hospital beds or critical care beds. My question is, are you aware of any plans, particularly in Morris County or in the district, where we are going to be moving and coordinating collaboratively with federal support, state support to create adjunct hospital beds, particularly as we move towards what's supposed to be the peak
Yes.
to prevent? Okay.
Yeah, so first of all, every hospital has been expanding its number of beds, its number of intensive care and critical care beds. They've been racing to stay ahead of this, and so far they've been successful. We're close to capacity, but we're not over capacity. I'd encourage everybody to look at the excellent dashboard that state of New Jersey has put up, which gives you the daily statistics, including a hospital census that tells you statewide how many ventilators we have in use, what the capacity is, what the remaining capacity for ICU critical care beds, our expansion potential, all that's there. It's very transparent, very useful. So, you know, we're not breaking the system yet. And hopefully if we are at the peak, then we won't. And all of that is due to the social distancing that all of us are practicing. So take a look at that. It's really interesting. We do have the Army Corps of Engineers has worked with the state of New Jersey to set up field hospitals. We have up in the Meadowlands, in Edison, field hospitals that largely have taken non-COVID cases to free up beds in our regular hospitals for COVID patients. Almost all of the beds in our regular hospitals are now COVID patients. And that creates other problems because we've had reports of people not calling 911, not going to the hospital if they have, you know, even like a small heart attack or stroke, and we need them to call 911 and go to the hospital. There's still capacity for critical care that people need. And our hospitals are losing a tremendous amount of revenue because all the elective surgeries, all the stuff, you know, that they depend on for the regular cash flow is not happening. Our primary care docs are losing a lot of revenue. So that's where some of the federal money is going to try to make up for that.
Thank you very much.
Thanks, Charlie.
Thank you. Our next question comes from Lisa. Lisa, can you hear us?
I can hear you. Can you hear me?
Yes.
Yes, ma'am. Go ahead with your question.
Excellent, because I'm just using the audio on the computer, so I wasn't sure how clear it was. First of all, Congressman Malinowski, I just want to say thank you so much for doing this. I've heard others comment as well. I want to just chime in. You are a breath of fresh air. Thank you so much for taking the time to do all this communication. I've never seen anybody do that in this local area, and I really, really appreciate it. I've tried to jump on a couple of your calls. Unfortunately, this is the first one I've been able to, so I'm so glad to be here. So number one, thank you. So glad you're voted in. My question is, it's about voter registration. I'm so concerned about this year's election in November. I know, like everyone, a lot of people are concerned about it, but even more now with the current circumstance, I just think this is really going to be a great opportunity, an excuse for a lot of people not to go out and vote. And I'm not saying that they shouldn't be concerned about their health and safety. I totally agree. So that's why I'm a really big advocate of mail-in voting. And so what I want to understand is, and I'm so appreciative that New Jersey allows mail-in voting because I know it's not available everywhere. And I have taken advantage of it because I'm somebody that travels a lot. So if I happen to be traveling that first week in November, I want to get my vote in. So I've gotten involved in, you know, how do I do mail-in? And I have children who are away at college and I want them to vote. And there's not voting on college campuses, which I still don't understand, because they're not going to come home just to vote. So then you lose thousands of votes in college campuses because, you know, because they can't vote if they're not home in the local area. So we have mail-in voting, like I said, and again, appreciative, but we don't make it really easy, right? Like when I first wanted to do the mail-in voting, I said, how do I do this? I went online, I'm like fumbling around trying to find a form or something. I find the form, then you can't just send it in online because no, that's, you know, we're not there yet. I guess I had to print it, I had to mail it out. It goes, I don't know, to your county clerk or something. I had to wait for my ballot to come, you know, the mail-in ballot. I mean, it's just a hassle, right? No one is going to do this unless you're really, really engaged, like I have gotten since 2016. I'm sorry to say not before that too much, but you know, now I'm very involved. And so we need to make this easy. Why can't every registered voter in the state, well, first of all, back up. Why can't we just mail voter registration forms to everybody, number one, or at least the ones that aren't currently registered? I'm sure we know who they are. And then if you are currently registered, why can't we just mail everybody a mail-in ballot and then have them fill it out? And if they would choose to go to a polling place, then so be it. That's fine. And I'm sure there's cross checks. We should know if you've already voted, right? And so you don't get 2 votes in. I know that's a big concern. But with everyone's busy life and all the complications we have now with COVID-19, voting, I'm afraid, is not going to be top of mind. I'm concerned in November, and I'm sure the Republicans are going to do their best to make sure we all forget about that date. And so what can we do to make it easy to get everybody a form and let them fill it out? Who do we need to talk to? Do we need to send letters to the governor? I mean, who makes these decisions?
So at the state level, it's the governor and the state legislature. So that's you know, you gotta talk to them, but I also talk to them, and we certainly want to advocate for the simplest possible, the easiest possible system of voting, registering to vote, voting by mail. In the CARES Act, in that proposal that we made that the Senate rejected, there was also a provision that would have required states to mail a ballot to everybody. So I totally agree with you. We should be making this simple. You know, lots of, you know, the argument on the other side. We've heard President Trump recently say that voting by mail is corrupt. It was an interesting thing because he votes by mail and his family votes by mail. And our military men and women of our armed forces vote by mail. We have 4 states in America where everybody votes by mail. They're Democratic states, they're Republican-leaning states like Utah. There's no evidence that voting by mail favors one party or another in states that go to vote by mail. And I think especially in an epidemic, if it's, you know, if we're in this situation somewhere in America in November, everybody's going to want this. Republicans will want it, Democrats, so it doesn't matter. People want to vote and they want to be healthy. They don't want to die. So I don't get how this has gotten so partisan. It just makes absolutely no logical sense. And we're going to continue to make that argument. And I think we will continue to make progress because we're only moving in the direction that you want us to be moving in. We're just not moving fast enough.
Thank you. I mean, it shouldn't, and I'll just add one other thing. I don't even think it should just be mail-in. I think we should have online voting. I mean, what century are we in?
I'm a little nervous about that still because I worry about security and.
I know that's a concern, security, but I mean, our federal government, the banking industry, that, you know, Wall Street. I mean, we know how to do things securely online. I don't know why people think
we have some adversaries that also know how to crack just about any code. And I would be careful. You got to have a system. Even more important than in Wall Street, you got to have a system that everybody trusts and believes in. And interestingly, we've actually been, rather than moving into the 21st century, a lot of us have been pushing to go back to the 19th century and to have paper ballots for everybody. And your mail vote is a paper ballot. That's one reason why it's one of the most secure ways of voting, because if anybody has any questions afterwards, you've got the piece of paper, you can check it. So
Right.
I think we may get there, but I'm not confident yet that we can do it securely.
Okay, thanks for taking my question.
Thank you, Lisa.
Appreciate it.
Thank you. Our next question comes from Sarah from Flanders. I'll read it for her, Tom. What is being done to better balance the economy, the economic impact of COVID-19 to small businesses?
What we are trying to do is to make it possible for every small business in America to stay whole, to keep their employees on payroll through this crisis, even if their doors are shut, so that they can resume normal operations as quickly as possible once we're ready to do that as a country. And so that's what this payroll protection program is supposed to do. We've also got an emergency grant program up to $10,000 that small businesses can apply for. We've got another provision. If you don't like the loans, you can get a tax credit for retaining your employees. There's a lot of stuff that we have done, which on paper is really, really good. In practice, the implementation has been chaotic because we're trying to move hundreds of billions of dollars to thousands and thousands and thousands of small businesses across the country in record time, and we're making it up as we go along. So we've got to be a little patient, but not too patient, because people don't have time. And I've been, as I said, on the phones with banks, telling them, you know what, this isn't perfect, but you can't wait till it's perfect. You've been drafted, just like people are drafted in a war. Like, we've drafted our banks to try to help right now, and you got to be willing to take some risks. And that's a message they're getting from a lot of members of Congress. And I think, you know, every day that program is going to get better.
Thank you, Tom. Our next question comes from Carolyn. Carolyn, can you hear us?
Yeah, I can hear you guys. Hi.
Go ahead with your question.
Thank you. Nice to see you. And again, thank you, Tom, for being here with us today and for all of your team and yourselves' hard work that you've done over the past few weeks. I actually did have a question about something that was happening to us, although I don't quite live in district anymore. I think it's an important question. We have a landlord who tomorrow is going to be inspecting our apartment, accompanied by an inspector and his wife. Insisting that he has to come inside to do the inspection because that's the law. And I know that this is a little bit more municipal, and I've heard other municipalities have put laws in place to stop this from happening and to ensure inspectors don't feel like they need to go into people's homes this year until June 1st. Mm-hmm. However, I was curious if you had any knowledge on how someone could deal with this and where the best resources are that I could use.
Tell me the municipality again.
I live in Morris Township, but
Morris Township. So that's outside of my district, so I can't call the mayor of Morris Township for you.
I actually already spoke with him, Mayor Grazel, and it's just something that the landlord said was not through the state. It's through a loan forgiveness program. Not really sure what he meant, but I didn't know if you were hearing of any other people going through something like this, because I know inspections are coming up this year. So right. Didn't know if there were other people who were struggling with that as well.
Yeah, we don't want people going apartment to apartment. That makes no sense.
No.
But I think, you know, it's something we can look into for you, but I haven't heard that specific example before.
Yeah.
And, you know, I would think that the municipality should be able to do something about it. But if he said no, that's a little weird.
Definitely.
Yeah.
I also want to state that my voting address is still in Springfield in Union County. So
good. Everyone should vote in the 7th Congressional District.
Yes.
Thank you, Carolyn.
Thanks.
Thank you, Tom. Our next question comes from Carmen. Carmen, can you hear us? No. All right. Our next question comes from a question that was previously submitted, Tom.
Go ahead.
What can we know is going to be promised in the fourth stimulus package that Congress should be voting on?
So we are trying to do several things. Number one, get more money for the small business program because we didn't do enough. And we also want to give the banks confidence that we're going to be there for them. They're not going to be left holding the bag at the end of this, so that they have the confidence to lend to everybody, particularly the truly small businesses that don't necessarily have established relationships with a bank. Number two, I've been fighting really hard to try to get more flexible support for our municipal, county, and state governments. As I mentioned, they're also going broke because of lost tax revenue, and it doesn't matter whether you're in the hardest hit area of New Jersey or not, everybody's hard hit economically, and we don't want that to happen. So far, the money that Congress has provided has been way too restricted to only larger cities and only to pay for COVID-related expenses, not to compensate for lost tax revenue, trying to fix that. We need more money for hospitals, very simply, for our healthcare system for reasons that we've discussed. We want to, fix some of the problems in the small business program and other programs that we've been discussing on this call. And then, we also at some point want to be thinking about the recovery. Right now, we're still just managing the situation. We're not actually stimulating the economy, even though we call this a stimulus. We're just keeping the economy on life support until we can give the patient the treatment that the patient needs. But at some point, we're going to want to recover from this in a big way. And my plan for that, and I'm not alone, would be do a big infrastructure bill for the country. And we desperately need it in New Jersey, obviously, from the Gateway project to fixing every road and bridge and railway station and parts of our power grid and everything else. It would put a lot of people to work. It would enable us to not just fix, but to modernize our transportation system so that we're moving towards that clean energy future that we desperately need as a country. And it would definitely stimulate the economy. Do it now when interest rates are basically zero. President Trump tweeted a couple of weeks ago that he agreed that he also wanted to do that. So we've got a chance actually to put together something bipartisan, and we're going to try to take that opportunity in the coming weeks and months.
Thank you, Tom. Before I turn it back over to the Congressman for closing remarks, just a reminder for everyone, if you have any questions that are still out there, if you need any assistance with any services the Congressman mentioned today throughout the conversation, please use the chat feature. And please, when you do that, just leave us some contact information so our staff can get in contact with you and address that question or your concern. And without further ado, I'll turn it back over to the Congressman for closing remarks. Thank you, everyone.
Thank you so much, everybody. And again, just to end where I started, I just want to pay tribute to all of you for being part of this effort to beat this epidemic. It's all hands on deck. We are all important as part of this effort. And then on top of that, there's just some extraordinary acts of solidarity and kindness that I'm seeing in the communities that I represent. A great example of that is Mount Olive High and Warren Hills High. Their innovation lab printing out 15,000 face masks, which were donated to the state, to our first responders, to our healthcare workers. It's just amazing that the kids can do this sort of thing nowadays, but also just a tribute to their character and commitment to their community. And so that kind of stuff, it's not even a drop in the bucket. That was a big donation. It really makes a difference. And between our efforts at the national level and those kinds of efforts at the local level, we're gonna beat this, even if we suffer some tragic losses along the way. And then hopefully we come out of it even stronger. So with that, I'm glad we had a chance to do this. I'm going to keep doing these. Please keep sending me feedback. Anybody who needs any help with these programs, as I said several times, let us know in the chat, and we'll have somebody reach out to you. And everybody stay healthy, stay safe, and stay in touch.